Tonight about the gaping holes in our healthcare system, this time from a specialist who works outside the overpass. Tonight, the doctor tells us that the shortage of specialists often means moving the sickest patients, putting them at greater risk. Here and Now's Deanne Fleet joins us live with more in our series, No Relief.
Tonight, there are hospitals around this province that don't have an internist on call, and you should worry. An emergency doctor might save your life, but it's the internist who'll keep you alive. They prop up our hospitals, and they're supposed to be on call around the clock. Time with her kids is precious to Dr. Stephanie Genge, because when she's on the job in Clarenville, she's on duty 24 hours a day, 7 days straight. When general internists like her are not on duty, patients must be transferred to hospitals with an internist. Genge says it happens all the time. Take Monday, when the internist went off duty in Buren.
A number of very sick patients that were down in Buren Hospital. Now he's leaving at 8 o'clock on Monday morning. There's nobody going to be there to manage them until Wednesday. So we had to scurry around trying to find places for those patients to go. So he was phoning every hospital in Eastern Health trying to see if they had beds and an internist who could accept those patients.
Now listen to the consequences of that.
Now you've got Buren down there with empty beds, nurses to look after the patients, but no internist to manage the patient. So you're blocking up all your other hospitals. So now if somebody comes in through Clarenville Hospital, through the emergency room with a fresh heart attack, my ICU is now full because I've taken patients from Buren. Where does that patient go?
Clarenville is only 2.5 hours outside St. John's. It's the health minister's district. But even Clarenville only has internists there 2 or 3 weeks a month.
It's not safe for patients. I mean, it can't be safe for patients. If you come into Clarenville or to Carbonear or to Buren and you're having a heart attack, and there's no internist there.
What's the impact of driving the sickest patients to hospitals hours away?
So we can never say exactly why the patient didn't make it. Is it because the system broke down, or is it because that was just a very sick patient?
It's happening around this province.
It feels like it's about to explode, and I know a lot of doctors are feeling that same way. When I'm out in Clarenville, the other doctors do tell me the same thing.
Ultimately, more and more of the sickest patients are being referred to internists in St. John's. But there's a shortage of internists and hospital beds here too, and already this week the internists have said they can't continue with this workload, that they cannot continue with this situation without even more negative consequences. Live for Here and Now, I'm Deanne Fleet in St. John's.
And we'll hear more from a doctor who had to make choices between work and family. Now more on the doctor's shortage. Doctors say there aren't enough specialists working in hospitals across the province. It means long wait lists and it puts patients' care at risk. Some doctors, like Dr. Stephanie Genge, have made a choice: the grind of an understaffed hospital or a life that focuses on their families and not the daily grind. You'd be surprised which one pays more money. Here once again is Deanne Fleet.
It's 1/4, 1/4.
Family is important to Dr. Stephanie Genge. After she had a son, she adopted 2 daughters from China. But she loves her work too. Genge used to be a family doctor, but she wanted more challenge, so she went back to medical school for another 3 years. She became a general internal specialist.
It was very hard on them when I went back to do a residency. They were used to me being around.
After all that work, Genge was gobstruck when Eastern Health offered her less pay than she got as a family doctor. Less pay, but a heavier workload.
I couldn't do that to my kids. I couldn't say, now I'm going to take a job that I'm going to have more responsibilities than what I had before. I'm going to be away from you more. I'm going to be more stressed when I'm home, and I'm not going to make any more money. So it's not like we're going to have more vacations or anything like that. So, you know, to me it was a no-brainer. I just couldn't do it.
General internists like Genge are not only scarce in this province, they're critically in demand around the country. 20 hospitals from Toronto to Thunder Bay offered to pay Genge more money to work 1 week a month, all expenses included. than a full-time internist in this province gets paid in a year. But in the end, Genge chose to drive 1 week a month to Clarenville. The money's almost as good as full-time, and she wanted to give back to her province without having to give everything.
I mean, I got this idea from a colleague of mine who's been doing this in Alberta because for the same reason. They're short of internists out here. He lives here and he travels out there for work. So with such a big shortage across the country, people are going to find jobs that are going to either meet their lifestyle demands or meet their economic, requirements.
Dr. Julia Trahy is an internist who works full-time here. The sickest patients in the province are often transferred to Trahy's care in St. John's. Her usual wait list is 9 months. Her workload is so heavy, she says it can't keep going on safely.
You get to a point where you say, well, will I continue on in a system where I feel that I'm being pressured to practice in unsafe conditions, or do I say, okay, I need to look for someplace else?
Stephanie Genge says she'd work full-time if she could get reasonable pay and a guaranteed workload that wasn't crushing. And she says until those issues are addressed, more doctors like her will accept one of the more appealing options out there. And that could put people here, especially in rural hospitals, even more at risk. Deanne Fleet, CBC News, St. John's.